Voices of Hope is a nonprofit organization made up of people in recovery, families, allies, supporters. They're in Maryland, but primarily in Harford and Cecil counties. Voices of Hope proves that recovery is possible. There is hope, and you can live a life free from addiction. We're going to hear some of these stories in the next 30 minutes. You don't want to miss them. I'm Christy Breslin, and this is Harford MagaScene. Jennifer Turk is the executive director here at Voices of Hope. She's joining us today to tell us all about the organization and how they are helping people live a life free from addiction. Hi, thanks for being here.
Hi, Christy. Thanks for coming.
Now, Jennifer, tell me, what is Voices of Hope?
So Voices of Hope is a 501c3 nonprofit. We're just a bunch of people in recovery and family members who are making a difference, trying to make a difference in the fight against addiction and overdose deaths in Cecil and Harford.
When did it first start?
It was about 2013. It was a bunch of people who were sober alcoholics, recovering addicts, and parents who lost their children, who came together to, make a difference. Like I said, we saw people suffering, we saw people dying. We knew that there was more that could be done. So we started meeting regularly in 2013, and it became Voices of Hope.
Now, Jennifer, I know you speak from experience. You've had your struggles. How did you overcome them? How did you get where you are today?
Well, thanks for asking. I'm a person in long-term recovery. I'm a product of early intervention services through the juvenile justice system and the public school system. Got in a lot of trouble when I was younger. I think it was mental health that was unaddressed, and I really liked to get high, and I got in a lot of trouble for it. But through these early intervention services, I was able to get in front of an adolescent counselor who met with me over time, and someone who believed in me and said that I could do this, and got me into a state-run facility. And that treatment center introduced me to the local recovery community through the 12-step fellowships. And I struggled a bit, but I've been there ever since.
Jennifer, at what point did you realize, I've got to get help, this is it?
I think the judge made it a little, he made it a little convincing. So I had been introduced to treatment and stuff before I realized I really needed help in this way. For me, addiction is more than just using drugs. It's like we have to ask, why are people using? Why do people continue to use drugs or drink, even though there's negative consequences? And for me, it was about, not knowing how to really deal with my feelings, not really having a lot of guidance in my life, and I really like to not feel, but there's consequences that come along with it. So I think when the consequences became great, and thankfully there's early intervention services and treatment was right there to meet me there. And we hope that continues for generations to come, that people have an opportunity to recover through easy access to treatment 24 hours a day.
In Harford County, we've realized that drug addiction is really substance abuse addiction, and it can happen to anybody, any gender, any ethnicity, any income level. Why is this happening now?
I think drug use is a part of our culture, whether it's caffeine, cannabis, alcohol, and, most people use some drug of some sort. When does it become a problem, is when our lives become unmanageable, there's consequences. Like I said, there's a question of why do people continue to use despite negative consequences? I think most people can stop or at least monitor themselves. And for those special group of people that just can't, it's to another level, and treatment needs to take place. And I think that we can all do better with making sure there's lots of options for people. We don't just try to throw people in jail or just throw people in treatment when they have substance use issues. It's like a conversation, to really ask people, well, what's going on? And that's what Voices of Hope is really good at, is not judging, not trying to push. We don't provide treatment. We're not trying to push people into something or that thing. It's about having empathy and compassion, availability, and just a conversation, and then helping people come up with a plan to know the resources that are out there and make sure that they can access them. But the number one thing is to stay alive while they're still using drugs. So harm reduction is super important in this overdose death crisis, that we make sure people have the tools to stay alive, because you cannot recover if you're dead.
Jennifer, thank you so much. There's so many resources here in Harford County, but also Cecil County as well. So thank you so much for sharing your story.
Thank you for your time, Christy.
Well, coming up next, we're going to hear another story from a resident that lives in Harford County and now devotes his time to Voices of Hope. That's next. Stephen Hawkins is the harm reduction supervisor here at Voices of Hope. He's here to share his story, how he got involved with drugs, but now how he's living a full life free from addiction. Stephen, thank you so much for being with us today, and thank you for volunteering to share your story.
Oh, no problem.
It's really brave of you to come on the air and talk about your story, and you have quite a story, but where you are today is proof that recovery can happen and hope is out there. Tell us about what you went through.
So I got wrapped up in substance use, and it was just really a dark road. I didn't really know what else to do. So I asked for help, and I went into treatment. And then while I was in treatment, I got connected with people that had a similar story of me, where I couldn't stop using drugs. I had caught a bunch of legal charges, theft, robbery, stuff like that. And, by being with people that had walked and done similar things that I have, they were able to help me push through and realize that, I can overcome anything in my life, and I don't have to use drugs over anything. And I was able to get to the other side of it, and put all that stuff behind me and become a productive member. And I got 2 kids of my own. I got a house of my own. I have employment, you know what I mean? I'm able to do all these things that seem so normal, that were so hard for me for such a long time, because I couldn't stop using drugs.
And you're working as a harm reduction specialist here at Voices of Hope. So what exactly is harm reduction? What does that mean?
So harm reduction is a set of principles and strategies that are all geared towards reducing harm in an individual. So something like, if I go to the beach and it's a bright sunny day out, right, we might use suntan lotion so we don't get sunburn. And the same concept pertains to Voices of Hope and harm reduction when it comes to substance use disorder. So what that means is it's like Narcan to help somebody stay alive. It could be condoms for helping people to avoid sexually transmitted diseases. It could also be Hep C testing to talk about different bloodborne viruses and stuff like that. And then it can also be like a syringe service program, where you're giving people clean syringes and all the utensils necessary to use drugs as safe as possible to avoid all those diseases, and just help you stay alive and keep you from suffering.
Now, Stephen, is there any proof that these services actually help people get healthier?
So the CDC says that harm reduction will actually help an individual are 5 times more likely to engage in treatment if they've been through a harm reduction syringe service program.
Now, Stephen, Voices of Hope is a peer-driven organization. What does that mean?
So peers are individuals like myself. I touched on how I used to use drugs, that I had, legal issues. I was homeless and all those things. And a peer is a person with lived experience. So I can sit down and I can talk to somebody who's struggling with substance use disorder and understand how they're feeling, what they got going on, and how I can help. And it's more than just giving somebody a resource. It's that feeling and that relationship of, I know how you feel. And Voices of Hope is filled, with peers with lived experience.
And is that how the peers actively help someone that is using drugs?
Yeah, absolutely. I mean, I've sat down and talked to people, and when we're sitting here and we're having a conversation, and the power of being able to say, "I've been where you're at," right? This is what I did, right? And look at me now, like I'm an example of hope for an individual to look at me and hear a little piece of me, and understand that there's another way. That recovery is possible, and we're here to help you.
Stephen, thank you so much, and I'm so glad to hear that you're doing so well, living a full life in Habit of Grace with your kids and your wife. Really proud of you, and your own words, you are clearly an example. Hope and recovery are possible. So coming up next, we're going to hear more stories of recovery and how Voices of Hope can help you if you are in need. There is lots of great programs offered for our community here at Voices of Hope, and Rachel Pedersen is here, and she's going to tell us about all the options that they have to help you get into recovery. Hi, Rachel.
Hi.
Now, we've talked about the peer support services and the variety of programs and services that you offer here. Can you elaborate a little bit more on what some of them are?
Not only do we do peer support for individuals that come in with substance use disorder, or even people come in looking for shelter. We can help with resources of that. We have over 200 resources on a master resource list to connect people. What makes us different from other organizations is we start engaging people while they're in active addiction. So we have harm reduction services that we offer, and we also offer recovery support services. We wrap around each individual and make sure that we are with them from active addiction all the way through, with treatment coordination, the harm reduction services, again, finding shelter. We have meetings here at this location, recovery support meetings. We do Narcan trainings. We also have a certified peer recovery specialist program where people can actually take trainings through Voices of Hope and become a certified peer recovery specialist, along with a community health worker. So all of these services that we offer, the Narcan trainings, we will go to an organization or a church, sober living houses, and train people how to use Narcan. We also provide the Narcan for them. But all of these services completely free to any individual that walks through the door.
What exactly is your role?
I'm the program supervisor here at Voices of Hope, which means I am the supervisor over the 11 peers that we have here at this location. I make sure that they're attending to our participants and doing everything that needs to be done here.
Well, the Aberdeen location, I know this is newer, and it's right near Ollie's, so
Yeah.
for anybody that, like me, that needs a point of reference, when did it first open?
So we actually started doing outreach here in Harford County in 2020, but we opened here officially in May of 2021.
Oh, that is fantastic. And what kind of results and success stories have you seen with your participants, not only them, but their families too?
Yeah, this work is so rewarding. The success that I've seen since I've been here, we have people, like I said, that engage us, through harm reduction, which means they come in to our syringe service program. They're active users. They start out there, but then after engaging them and building that relationship, they learn to trust us. They understand other services that we offer. And, one in particular, she was coming and getting services for a couple months from us and just broke down one day and said, "I need help. Can you help me get into treatment?" And we have those kinds of stories all the time. We also go to do outreach and go to homeless encampments. There is one particular individual that we engaged over a period of time. She learned to trust us, and she asked for help. We got her into treatment, and she went to sober living, but through the course of that, she found out she had cancer, so she got treatment for cancer. She's now a cancer survivor, and she has 6 months in recovery. We have multiple stories like that all the time, which just makes this work even more rewarding.
Now, Rachel, we also know that transportation can be a big factor in this. We have a lot of the population that would have a hard time getting to meetings and programs here at Voices of Hope. How do you address that?
Yeah, well, we have a lot of people who do have that issue. So Voices of Hope has 4 vehicles. We have 1 here in Harford County, 3 in Cecil, that will we will use to help provide transportation to get to and from treatment, to get to meetings, recovery meetings, to go to the doctors, to go to the courthouse. We even have picked up people from the detention center and taken them to treatment. So, all of this free of charge.
Rachel, thank you again for all that you do and taking the time to sit down with me, and so many great resources right here in Harford and Cecil County.
Thank you.
Now, what is peer recovery and what are community walks? We'll have all those answers coming up next. Britt Lofthouse is a certified peer recovery specialist here at Voices of Hope, and she has helped so many people, and she's here to tell us about more of the services and speaking from experience of how Voices of Hope can help you get on the path to recovery. Hi, Britt.
Hi, how are you?
Great, thanks for being here.
Thank you.
Britt, you have earned your Maryland certification as a peer recovery specialist. You also have your third associate's degree, and you're working full-time. How do you balance this all?
It's hard. Learning how to balance that with my recovery and work is hard, but I rely a lot on my network, my sober network. And working in a place like this really helps me. We implement like RAP plans and stuff like that, which is a wellness recovery plan. So it really helps me to focus on both my recovery and succeeding at work.
How does the work that you do here help the people that come through the door?
So we are advocates for people. We help them to whatever point of recovery they are in. We help them to either get into treatment. We help them with peer support along the way, all through that process. We also help people who are struggling with substance abuse, just learning how to cope with life on life's terms.
What kind of skills, what kind of attitude do people need to have to be a good peer recovery specialist?
I definitely think compassion and empathy is the number one thing that people need to have in this field. Also healthy boundaries. We give a lot of ourselves to people. So also relying on our own recovery and wellness in order to help people.
Now, I've heard a lot about these community walks. What exactly is that?
So we go out with backpacks. We are boots on the ground. We reach out to people who otherwise can't get to us. So being able to get out to the community, tell them, like, showing up, trust is a big thing for people. So learning how to show up for people and bring harm reduction supplies, or just meeting people where they're at.
Now, do some of the people that you've talked to on the walks, do they come to the Aberdeen Center for more help?
Yes, absolutely. We also have bus passes that we can help people who are participants of ours reach us that have a barrier to getting treatment and things like that with transportation. So they definitely do follow through, and they know that this is a safe place for them to go.
Britt, you've come a long way. You've had a rough road, but you're doing so great today. We are so proud to see where you are.
I've come a long way. I relocated to Harford County in 2011. I've been able to work in the healthcare field. I'm working on my third AA degree. Recovery gave me my life back. I was a shell of a person. And now through working my recovery program and working in a place like this, I have a purpose. So it's really great to be able to share that with others.
Well, Britt, thank you again. I know that you've helped so many people, and we appreciate it. We are so lucky to have people like you in our community.
And thank you.
Well, coming up next, we're going to speak to a very familiar face here in Harford County, and he's going to talk about his passion and why he works so hard to bring the mission of Voices of Hope to fruition. Stay with us. You know him, you love him. Don Mathis, very familiar face here in Harford County. You've worked with him at one point or another. He is now a certified peer recovery specialist here at Voices of Hope, and he is here to tell us all about it. Hi, Don.
Hi, Christy.
Don, you work as a peer recovery specialist and a community health worker. And like a lot of your peers here at Voices of Hope, you're in long-term recovery, which, by the way, I had absolutely no idea.
Well, Christy, before we get into my story, I just want to take a moment to thank you and the people at Harford TV and Kelly Jower and the whole team over there. What helps communities bounce back and beat back addiction and substance use disorder is when everybody in the community gets involved in it. And I've gone through the Harford TV files. I know you've talked about Char Hope Foundation. I know you've talked about Addiction Connection Resources. I know you've talked about Rage Against Addiction. I know you did a segment of stories about people with addiction and recovery. And that kind of message that you all sending from Harford TV is absolutely essential, because when everybody comes together, local media, religious groups, law enforcement, the schools, nonprofits like Voices of Hope, that's what gives us the best chance to recover. So I really want to just take a moment to say thank you all, because it really makes a difference, and I'm grateful for today.
Now, Don, you know better than anybody. How big is this problem that we have here in Harford County? How significant is it?
It's a big problem, and it's kind of a good news, challenging news kind of story. As you alluded to earlier, Christy, I am in long-term recovery. I've been sober since I came to Harford County 39 years ago, and I'll be 39 years sober this coming November. But if you had looked at this man 41 years ago, you probably wouldn't have liked the person you saw. I was drinking heavily, I was using meth, I was smoking a lot of weed, and I was doing really self-destructive things for myself and hurting other people. And the woman I was living with at the time, who I loved with all my heart, said, "You're an alcoholic, you're a drug addict, you can't be with me and my kids." And when she threw me out, that's how I got into treatment. So I've lived through that, and I am one of the peers here. In terms of our local circumstance now, when I was smoking marijuana before, it was 3% toxicity of the THC, the active ingredient. Now it's 25%. When I was doing meth before, it would take me 2 or 3 days before I really got psychotic. Now the high potency meth that's being produced by the cartels in Mexico and being brought in here, people come in the door and you can tell right away that they're hallucinating, acting out, and are actively psychotic. And one of the strengths that I can bring as a peer is when somebody comes in who has had a meth experience, I can relate to them more easily than someone who maybe had a heroin experience or what have you. The good news about Harford County and starting with Cecil County is we have a lot of resources here. I mentioned some of the agencies you've interviewed before. They're all good. We have a series of recovery homes. We have the Klein Family Center in Bel Air. We have other kinds of resources that are available. I know you've heard about Narcan. That's the drug that reverses an opioid addiction. Somebody has an opioid, a fentanyl, the high potency step addiction, you can put some Narcan up their nose, squeeze it, and hopefully it'll bring them back rather than having fatally overdosed. The downside is there's a whole lot of new drugs. Xylazine, which is commonly an animal tranquilizer to use, is being mixed in with fentanyl now because it accelerates the high of the fentanyl and the heroin. The thing is, xylazine is not an opioid. So if somebody is overdosing and they've had fentanyl with xylazine, the Narcan will deal with the fentanyl, but it won't affect the xylazine. And it also causes immense open wounds and sores. That's why Voices of Hope has a wound care nurse that can really help these people. So the drugs are more prevalent. I know you've asked the question before, why here? We're on the 95 corridor. There's a big drug market in Philadelphia. There's a big drug market in Baltimore. They can come here. There are less police in Harford County than there are in downtown Baltimore. And it's not just, poor folks that are getting this. There are young people and old people that have a lot of money that want to get into the addictive stuff. And it is addictive. You mentioned before earlier in the show about how it's a disease. Well, it's a brain disease, and the drug takes over your brain, and the cravings can't be denied for that person. Last story, when I was in drug court, there was a woman 35 years old standing up before the judge. I was a case manager there, and she said, "Your Honor," and she's getting ready to go back to jail. "Your Honor, I love my children, I love my husband, I'd love to be home, but if somebody put a bag of heroin in front of me, I'd shoot it up right now." That's the kind of craving and demand that addiction takes, and that's what we try to deal with here at Voices of Hope.
Now, Don, you've mentioned you've lived in Harford County for 30 years. You've worked for the Boys and Girls Club, Ashley Addiction Treatment Center, and the 4 drug courts. So talk about your aspect, your view of the problem that we have here in Harford County from what you've seen and experienced.
Well, it's gotten a lot worse, not because people have gotten worse, because the market has gotten there. I mean, there are more really not very nice people that are selling and poisoning drugs. And one of the issues right now in Harford and Cecil County are the counterfeit pills. So, for instance, if a high school student or a college student, wants to stay awake for an exam, or they're feeling depressed, instead of taking a Percocet, which would be an anti-anxiety drug, or some kind of stay-awake pill that will help stay awake, it's counterfeit. And it's got fentanyl in it. And the stories of, especially young people that have taken one counterfeit pill that they thought was relatively harmless, ends up killing them. So we have 14 and 15-year-old young people that are dying. Conversely, one fact that isn't really well known is that the fastest group of people becoming addicted in Maryland are over the age of 50.
I did not know that.
Yeah, but that statistic came up. And the other thing is that's kind of been helpful. I mean, where we've been in Harford County, 20 years ago, we were in denial. Oh, this can't happen here. These aren't our people. This isn't really real. This is a big city problem. We've all come over that because just about everybody knows somebody or a family or a coworker or somebody in a religious organization that's been affected by addiction. So it's people, like you said, of all income levels and what have you. That widespreadness has gotten rid of what can happen here to it's happening here. What do we do about it?
Right.
And the positive answer is there are solutions for that.
Now, I know that we're making some progress, but what advice would you give to someone that is seeking recovery? The person themselves, family, friend, coworker, what would you say to them?
Well, seeking treatment or their family seeking treatment for a loved one there are solutions. There is hope. We're not the voices of hopeless. We're the voices of hope. And there are medications that have been developed that help people detox and stay sober. There's a lot of peer training. I mean, people that can come in, when they talk to us here at Voices of Hope, Christy, they're talking to somebody who understands what they've been through, who is empathetic, who can put up with some of the maybe acting out behaviors that they might have, or identify with their just depression or what have you. So there are solutions. There's treatment, there's hospitals, doctors are becoming more aware. It's one of those things, the more we learn, the better we do. And we're learning more about substance use disorder. We're learning more about behaviors. But I think there's also been a problem, and I think you can't pick up a newspaper or a periodical or watch a TV without hearing about the mental health crisis affecting our young people and affecting what have you. And those are, when the addiction meshes with mental health issues, so it's called co-occurring, that's really an acute situation that has to be done. And the suicide rates are going up. The number of people dying from fatal overdoses is going up. And we really need to keep getting a handle on this. We're doing good stuff now, but we need to redouble our efforts, and that's what we do at Voices of Hope.
Don, thank you so much. You are a blessing to have. And for anybody that needs help, wants to volunteer, wants to make a donation, how do we do that?
Well, thanks, Christy. Voices of Hope, you can just Google us or word search. You'll see our phone number on the screen. We're here in Aberdeen, near Raleigh's, like you mentioned. We're also in Cecil County. We're real easy to find. We're always looking for volunteers. We have a rigorous volunteer program. You just can't walk through the door and say, I want to be a good person. But we accept donations of cash and good. And I work with 45 other peers, Christy, at Voices of Hope. And we're just going to keep keeping on.
Okay, Don, thank you so much.
Thank you.
Well, I hope you've been inspired by the stories of recovery that you've heard today, because recovery is possible and Voices of Hope is here to help.
Thank you, Christy. Thanks to Harford TV. And the message is clear. Treatment works. Recovery is possible. We're here at Voices of Hope in Harford and Cecil counties to help you. Our contact information is on the screen. And there is always hope. There is always hope for somebody, no matter how hard it may be. And that's what we do. Thanks, Christy.
Well, thanks for being with us. I'm Christy Breslin. We'll see you next month on Harford MagaScene.